out your research series. Today marks our halfway point. So with today's lecture, we are halfway through the seminar series. We're going to be using VoxVote again today. So please log in to live.voxvote.com. And here's the pin. For those of you on the Uptown campus, I know you can't see it. So the pin is 99802. Our speaker today is Dr. Gina Dobeck. She is going to be speaking on the use of live vertebrate animals in research. She holds a DVM degree from Texas A&M, and she did her residency training in laboratory animal medicine here at Tulane. She's a director of Tulane's Department of Comparative Medicine, and in that role, she supervises the operations of 3 animal facilities. She provides research guidance and support to investigators. She trains investigators, lab animal medicine residents, students, and staff, and she provides medical and surgical care for research animals. She is also a diplomat of the American College of Laboratory Animal Medicine. So, Dr. Dobeck, I will turn it over to you.
So for those who don't know about my department, comparative medicine, we help take care of all of the research animals here on campus, so the uptown and downtown campus. We don't deal with the monkeys at the primate center. They have their own veterinarians. Another important role for our office is to help facilitate research. So we provide investigators with the animals that they'll use. We make sure that they're being used humanely and according to all the laws and regulations that we're going to talk about. And then I also provide veterinary consultation. So today we'll mostly be speaking about the regulations and the ethics of working with research animals. And when you talk to somebody outside the research fields about animal research, we'll sometimes get questions like, why do we even have to use animals for research? We have cell cultures and computer simulations. Can't those take the place of live animals? Another question, and the results that we get from animal research be applied to humans. How similar are we? So we'll talk about what we've learned so far from animal research. I'll give a few examples of some research fields where animals continue to play an important role. We'll talk about the difference between animal rights and animal welfare. And we'll talk about how the animals are protected. And we'll also talk about your role and responsibilities as investigators in complying with regulations and maintaining animal welfare. Okay, so going back to that first question, why do we need to use live animals for research? So first, in order to develop treatments and cures for human diseases, we need to understand the basic physiology that underlines these disease processes. This is basic physiology that we share with all vertebrate animals. Secondly, animals are needed as an index of safety prior to work being conducted in humans. So the Nuremberg Code was created in 1949 following military tribunal trials of several German doctors who were conducting unethical medical research on humans during World War II. So the Nuremberg Code outlines 10 basic principles that have to be followed in human subject research so that it can be considered ethical. And these principles include voluntary consent, avoiding injury to the study subject, the researcher has to be qualified, and so I'm sure you'll talk about all of this during the human subjects portion of the RCR. And principle number 3 specifically addresses the need for animal research. So it says the experiment should be so designed and based on the results of animal experimentation and a knowledge of the natural history of the disease or other problem under study. The Declaration of Helsinki was adopted by the World Medical Association at their General Assembly in Helsinki, Finland in 1964, and that is a statement of ethical principles for medical research involving human subjects, and it is expanding on the principles that was outlined in the Nuremberg Code. and it too addresses the importance of preliminary animal research. And then another reason we need to use live animals is because the body is made up of multiple types of cells, tissues, organs that are all working together. These processes can really only be studied in a whole living organism, not just a 2D cell culture on plate. And the use of animal models is also important for teaching. So we need to train our next generation of scientists, physicians, veterinarians, nurses, etc. So one argument that's often made against the use of live animals for research is that we have alternative technologies like cell culture available. And these alternatives are important. They're excellent screening tools for new drug treatments, for example. But again, they can't completely replace the need for a complex living organism. In addition, follow-up testing in animals is required by law. So the FDA has what's commonly called the 2-animal rule. The FDA requires that if a new drug or biologic is being developed for humans, it first has to be tested in at least one animal species before that testing can move on to human trials. So while the in vitro models are important, they still don't have the power to completely replace the need for animals.
So one's like usually, if one is the minimum, but usually they'll require 2.
Mm-hmm. Yeah. Sometimes if it's like an emergency situation, they can speed the process along, like, for example, Ebola vaccine. Another question that's asked is, can these results be applied to humans? So the answer is yes. There are many similarities between humans and different species. So here is a list of some specific areas of study and the species that are used ideally for those. In addition, we now have transgenic and even humanized rodents. These give us the power to create specific diseases in humans in these animals. And we also now have transgenic zebrafish as well. So those are becoming even more popular as models of human disease. So the importance of these animal models is evident when you look back through history. Nearly all medical advances were in some way shaped by animal research. So as an example, of the 216 Nobel Prizes that have been awarded in physiology and medicine, 180 of those utilized animals in the research. That includes every prize awarded for the past 30 years, including this year's was awarded for the discovery of cancer immunotherapy, and those 2 recipients used mice in their research. So let's do a box vote.
All right.
This is going to be like a word cloud response. You can just
Maybe read
Sure,
the
word.
question for our uptown people.
Question is, what are some life-saving medical advances that have been developed with the help of animal research? Give your best guess. Insulin, yeah, that's a big one. What else we got? Vaccines. Yeah, basically every vaccine that's used in animals and humans was created with animal research. Like HIV treatments, chemotherapy. Yes, these are all excellent examples. Good job. So these next 3 slides will show just an example of some of the most important scientific discoveries, and some of those you already named. So vaccines, organ transplants, imaging modalities like CT scan and MRI, and then treatments for a whole host of diseases, diabetes, asthma, Parkinson's disease, HIV. So that's all well and good historical data, but the research to understand the mechanisms of diseases continues. So one of those areas of research is autism. Autism is a challenging area of research because it's a spectrum of diseases. It varies widely in its presentation and severity. And we're just starting to understand that there is a large genetic component. A variety of genes play a role, as well as environmental factors. And there are over 80 different genetically modified strains of mice just for the study of autism alone. So the mouse, in my opinion, is the superhero of autism research. What's interesting about these mice is that they show many of the same behavioral characteristics of people with autism. So mice are very social animals. If you were to put a normal mouse into a cage where it was separated from a strange mouse, it would immediately go over to that strange mouse and introduce itself and try to figure out who it is. Whereas the mouse with autism doesn't care about the other mouse in the cage. Mice with autism also show compulsive and repetitive behaviors that are similar to behaviors in humans. So they spend a lot of time grooming, and they show signs of anxiety as well. So one way to measure anxiety in a mouse is to put it in a cage filled with marbles. An anxious mouse is going to bury the marbles to try to get rid of them. From a video. That shows social interaction in two mice. So the mouse on the left is the one with autism. The one on the right is a normal mouse. So it's exploring its cage. It's going up to the other mouse saying, hey, who are you? This mouse on the left is just sitting there grooming himself repetitively, doesn't care about anything else that's going on. Okay. Next, we'll talk about obesity.
Can you close the video conferencing window?
Oops, sorry. Welcome back, Uptown people. Sorry.
Slideshow.
Okay, so we all know that obesity is an epidemic in the Western world. It's a major risk factor for a whole host of diseases. In the United States, 64% of adults and 1/3 of children are overweight. In the Gulf South, obesity rates are the highest in the country, consisting of about 33% of our population. So we have several mouse and rat models available that allow us to study the development of obesity and resulting health conditions. So this is a picture of the Zucker obese rat, also called the Zucker fatty rat. It has a mutation in the leptoreceptor gene, and it is characterized by obesity, overeating, high triglycerides, and it does develop type 2 diabetes. And here's a picture of the lean control rat for comparison. And then a major focus of research here at Tulane is pathogenesis of HIV and the development of AIDS. So the disease first appeared in the early 80s. A blood screening test was developed in 1985 with chimpanzees. In the late 80s and 90s, mice and rhesus macaques were instrumental in the development of antiretroviral drugs that are now used to treat people with HIV. And the rhesus monkey is really an excellent model for HIV and AIDS, and it's still the premier model that's being used today as we're looking for improved therapeutics and ultimately a vaccine for HIV. The good news is here, when the antiretroviral drugs were developed, the number of people living with HIV has dramatically increased. Unfortunately, the number of new HIV cases has stayed the same. So there's still an issue with new infections. And here in the Gulf South, again, not only number one in obesity, but number one in HIV infections as well. So there's clearly a continued need for research so we can ultimately find a vaccine to prevent these new infections from occurring. Now we'll get into the regulations. How are these animals protected? One of the federal regulations is the Animal Welfare Act. This was first signed into law in 1966. It's enforced by the U.S. Department of Agriculture, and it's been amended several times since it was first enacted to expand protections for laboratory animals as well as other animals. In 1985, the Health Research Extension Act was passed. This is enforced by the NIH, Office of Laboratory Animal Welfare, and it applies to all public health service funded research, so all NIH, NSF research. Both the Animal Welfare Act and the PHS policy are broken down into sections that describe the requirements for adequate veterinary care, the housing and feeding of the animals, how their enclosures are cleaned and kept sanitary, and then how they're monitored. Each institution is required to have a documented emergency plan, and every proposed research study must go under review and be approved by an Institutional Animal Care or Use Committee, or IACUC. And if an investigator is found to be non-compliant with the regulations, then Tulane is required to report that individual to the federal government and their funding agent.
Which is not fun.
Yeah, that's Brian's job.
I know, yeah.
And he doesn't like that part
have,
of his job.
I like not to have to. Yeah.
Because Tulane receives money from the federal government in the form of grant dollars, Tulane is required to file an animal welfare assurance with the NIH. This is basically a contract that says, in exchange for this money, we are going to follow the law, and this is how we're going to do it. Tulane is also a registered research facility with the USDA. The NIH is allowed to come out and inspect us at any time unannounced. The USDA does come out every year unannounced to inspect us. And Tulane is also accredited by an organization called ALAC. This is a voluntary accreditation process that we go through. It shows that Tulane is actually going above and beyond the minimum required by law. And ALAC comes out and visits us every 3 years. They're going to be visiting us very soon. Okay. We've established that animal research is necessary and important, that the animals are protected. So how can we, beyond just following the law, how can we ensure that the animal research is being performed in an ethical manner? One of the guiding principles for conducting ethical animal research that's used throughout the world is called the 3 Rs. These stand for replacement of animals with non-animal models like cell culture or less sentient animals. So instead of using a dog, if you can use a mouse, that's better. Instead of using a mouse, if you can use something like a Drosophila fly, that's even better. The second R stands for refinement. So whenever possible, we're trying to continually improve our procedures so that we reduce pain and distress to the animals. And the last R is for reduction. And this is using the smallest possible number of animals that gives us statistically significant results. Let's talk about the numbers. Mice and rats are the powerhouses of research. 95% of the animals used in research are mice and rats. Of the remaining 5%, less than 0.05 are cats, dogs, and non-human primates. And over the years, the number of cats, dogs, and non-human primates in research has continued to fall, which is excellent. You may be looking at these numbers on the left-hand axis. You can read them and thinking, wow, that's millions. That's a lot of animals. So how many animals are we talking about here? Our next Vox vote. Can anyone guess how many animals are used in research in the United States each year? $19 million in first place, followed by 26 million. I kind of gave it away by telling you it was in millions. Okay, those are good guesses. The answer is 26 million. So if each of these mice represents 1 million mice, that is 26 million animals that are studied and ultimately killed every year in the United States alone for research. And I don't think anyone here is going to deny that that is a lot of animals. Mm-hmm. And that's why that R of reduction is so important. Our goal should be to always work toward reducing that number by conducting sound science, by avoiding unnecessary duplication of research, and by strengthening the capabilities of those in vitro models so that we can continue to lower that number every year. But let's put that number into perspective. I don't have a polling software question for this next one, but does anybody want to guess how many chickens are killed each year for food in the United States?
Probably billions, hundreds of millions.
What'd you say?
Or some 5 billion.
5 billion? You're very close. Very close. That's a good guess. So if each of these dots represents 1 million chickens, over 9 billion chickens every year in the United States alone for food. So this graph shows that same information with, so here's 26 million animals for research, 9 billion chickens. We definitely love our chicken in the United States. And then 150 million killed for sport, hunting each year. 365 million killed by vehicles on highways. And then this is other food animals broken down, pigs, cows, ducks, I believe is the other one. So yes, we use a lot of animals for research, but that number is quite small when compared to all the other uses of animals that we use. And the last topic we'll talk about today is animal welfare and the role that we all play in promoting animal welfare. So animal welfare is a concept that as humans, we have a moral obligation to provide for the well-being of animals. Because we use animals for food, companionship, clothing, entertainment, and research, then we have to make sure that those animals who are giving so much to us are treated humanely. This is different from the concept of animal rights. Animal rights is the viewpoint that all animals have the exact same rights as humans. So people who believe in animal rights believe that we should not be allowed to own or use animals for any reason, whether it's for food, clothing, entertainment, circuses, or zoos, or for animal research. And some individuals take that belief so far as to say that we should not be able to own animals for any reason, including pets or working animals. And there's several organizations for people who identify with animals. The famous one is PETA, which is People for the Ethical Treatment of Animals, for those of you who don't know. Animal rights organizations like PETA feel that all animal research is unnecessary and should be abolished. Their director and co-founder, Ingrid Newkirk, has been quoted as saying, "Even if animal research resulted in a cure for AIDS, we'd still be against it," amongst other inflammatory remarks like committing arson. The majority of animal rights activists are peaceful. They pursue their campaigns legally, with protests and slick advertising campaigns like Justin Bieber over there. And that's their legal right to do that. This is in contrast to animal rights extremist groups, which advocate violence and terrorism to achieve their goal. And the FBI does consider these to be terrorist organizations. Examples of extremist groups that operate in the United States include Stop Huntington Animal Cruelty, or SHAP, and Animal Liberation Front, or ALF. And the spokespersons for these groups have stated that they consider violence, including murder, to be justifiable and necessary. Good news is that in 2006, the Animal Enterprise Terrorism Act was passed that expanded protections for academic and other institutions that use animals and increased the existing penalties against animal rights extremist groups. And that did lead to the conviction of several individuals who were targeting researchers, and they were in prison. Going back to animal welfare, how do we at Tulane as a research institution ensure that we are committed to animal welfare? So it's not just the responsibility of the IACUC or me and my staff over here taking care of the animals. It's really a team effort that requires cooperation from everybody, investigators, as well as the leadership of the university. The institutional leadership, in this case specifically the institutional official, plays an important role at each research institution. The IO is typically a high-ranking individual, often the CEO or president of the university. In our case, here at Tulane, our IO is Dr. Laura Levy. She's the vice president of research. And their job is to provide leadership. They disseminate all of our institutional policies, and they set the standard for research at the university. They also have the power to allocate resources and money so that we can maintain a high quality of animal care and a high level of research. And they're the ones that appoint members to the IACUC, and they provide annual reports to the USDA and the NIH Office of Laboratory Animal Welfare. Each institution is required to have an institutional animal care and use committee as part of its animal care program. The IACUC is responsible for upholding all these regulations. No research using animals can move forward without approval by the IACUC. Each IACUC committee is required to have at least one veterinarian, a scientist, a non-scientist, and a member of the public who is not affiliated with Tulane. Those are the minimum requirements. And when reviewing the IACUC protocol, the committee is looking for justification for why the investigator has to use animals. Are the individuals involved properly trained and experienced? Has the investigator considered alternatives to the use of animals or alternatives to painful and distressful procedures? And if pain and distress is expected, how is that going to be alleviated? In addition to reviewing the proposed use of animals, the IACUC also reviews the institution's entire animal care program twice a year. They also inspect every room on campus where animals are housed or used every 6 months. They're the ones that investigate any concerns about animals. And then in the case that there is an investigator who is non-compliant, either with regulations or with their IACUC protocol, the IACUC has the power to suspend their research and report them to the federal government and their funding agency. Doesn't happen often, but it's happened here before. It's more paperwork for Brian to do.
And sometimes the IACUC can be non-compliant, and we have to report
That's
ourselves.
true. Yeah, even
Like
the
if we
IACUC can
don't
not be
have-
following the law. Okay, before we move on to animal care, our next cog in the wheel, let's do a box vote. See if y'all are still awake. Federal law requires every ICOOK committee to have which of the following members?
For all of the above, does that mean all of them on there?
All of the above should be at the bottom.
Okay.
Y'all are right. It is all of the above. Good job.
So why, what's the importance of having a member of the public?
So the member of the public is giving the viewpoint of a public member who doesn't do research, who is not affiliated with the universities. They have no care really about what happens here at the university. They're there as a community member to voice their opinions about the research and voice any concerns they have about the research.
How do you find that person?
That's probably the trickiest person to find for any committee. They're often clergy members. Sometimes we've had retired members of the military. Police officers often serve. So often retired folks who are willing to come and sit on the committee and get a free meal every now and again.
For all the various committees have this requirement, so like the IRB, the Institution of Biosafety Committee, and sort of like if we ever hear of someone that's not affiliated with the university that might want to do this, then we would like them to be a member. Yeah.
Okay, so moving on to animal care. This is the veterinarians, the animal care technicians, and a host of other individuals who are keeping the animals happy and healthy and the animal facility running smoothly. Each institution is required by law Okay. I blame the Mac. That's my story. I'm sticking to it.
It is another.
So each institution is required to have an attending veterinarian who's a member of the ICOOK and is responsible for the care and health of all the animals on campus. So in addition to clinical duties, the attending veterinarian is responsible for management of the animal facilities, providing training and technical assistance to anyone who works with the animals. The attending veterinarian also has the power to halt any activity if they feel that the animal's welfare is at risk or if the work is not being performed in compliance with the ICOOK protocol. And the attending veterinarian has the responsibility to report any animal concerns or non-compliance to the ICOOK. The animal care staff is doing the daily husbandry of the animals, providing their food and water, their enrichment, and their socialization, as well as maintaining the facility. And they really serve an important role because they are the boots on the ground, eyes in the field. So if there's a sick animal, something doesn't look right, they're the first ones to see it and they quickly report it. And that's often how the majority of non-compliance concerns are found and reported to the ICOOK is because the animal care staff found it. Our staff at Tulane takes care of the animals 7 days a week, 365 days a year. That includes weekends and holidays and Mardi Gras and all those other days. Also emergency closures at the university. We're here on site taking care of the animals. We are considered essential personnel. And a veterinarian is always on call during weekends and holidays. It's usually me. Okay. Finally, what are your responsibilities as investigators in maintaining the welfare of the animals you work with? First, you have to obtain ICOOK approval prior to beginning any research or teaching protocols with animals. You have to obtain your animals through approved means. That's typically through my office, unless you are a field researcher who's out working with wild animals. And you cannot make any changes to your experiments until you've submitted an amendment to your IACUC protocol and had those changes approved by the IACUC. In addition, it's your responsibility to cooperate with the IACUC and provide any information that they request about your animals. As I mentioned earlier, the IACUC does have the power to suspend an investigator's research if they feel that there's serious non-compliance occurring that threatens the health and welfare of the animals. And investigators are required by law to abide by that suspension. Very important that you do not allow your IACUC protocol to expire if you have animals on that protocol. The federal government does not allow animal research to be performed without an end date IACUC protocol. Also, the NIH and other funding agencies will not allow their funds to be used to pay for animals on an expired protocol. And we have had some instances in the past where investigators let their protocol expire for several months, and those individuals had to find an alternate means to pay for the per diem for those animals because their NIH grant wouldn't cover it. All right, let's do another box vote. This one is, what are the consequences for non-compliance with the federal regulations? And I guess that top one should say all of the below.
On the phone, it's in the right place.
It is,
It's in the right place.
Interesting.
I don't know what happened.
All right, these are
Yeah.
easy questions. It is all of the above. So not only can the investigators' research funding be suspended, the funding for the entire institution could be revoked. So that would have to be a pretty serious violation, but it is very possible that the NIH could say, Tulane, you are not getting NIH money anymore. So that would be a really big, bad deal.
and they do, like they, as in the regulators and NIH, do emphasize continually to us that doing animal research is a privilege, it's not a right. And I think if an institution had some issues and was not responsive to them, that is when perhaps all animal funding would be revoked.
Okay, so the PI is also responsible for their staff and students who are working with the animals. They have to ensure that all the personnel who have contact with animals are added to their IACUC protocol and have been appropriately trained for their role. They are responsible for records, so anything that's done to an animal has to be documented. Those records have to be up to date and complete and ready for inspection at all times. I mentioned that we have regulatory bodies like the USDA and the NIH that come and inspect us unannounced. We have ALAF that comes and does inspections every 3 years, and the IACUC every 6 months goes around to every lab where animals are used. They always want to see students' laboratory notebook, especially where survival surgeries are being documented. And the PI is also responsible for the safety of their personnel, making sure that they have been enrolled in an occupational health program. And as investigators, you have a responsibility to report concerns that you have about animals. So if you ever have a concern about the health or welfare of animals, please contact one of these individuals, including Brian or myself. We have our contact information posted on the entrance to all the animal facilities. Your identity can remain anonymous if you wish, and if you are a Tulane employee, then your job is also protected. So here's the contact information for Brian's office, and then Tulane also has this new third-party, completely anonymous compliance hotline that you can use to report any concerns. So I know that was a lot of information to cover in a short amount of time. I hope that y'all leave here today understanding that these animals are very well protected, highly regulated, and very valued animals. So our biomedical researchers understand that happy, healthy animals make the best research subjects because they produce the best data. And my staff come to work every day because we love animals. They're important to us. We enjoy working with them. Anyone have any questions? Acknowledge these folks for helping me put this presentation together. Here's some additional resources. I want to learn more.
Any questions for Dr. Dobeck about animal research?
How did you decide to go into this field?
So I didn't even know this field existed until I was already in veterinary school. And then I did a summer research program, and it included a presentation portion at LSU. And I got to meet a laboratory animal veterinary resident, and they told me all about the field. I said, well, that sounds really interesting. So that's kind of how I fell into it. Great, thanks, guys.
Thank you.